Imagine a world where illness was attributed to angry gods or bad luck. This was the reality before Hippocrates, a revolutionary figure who laid the foundation for Western medicine. This deep dive explores the life and work of Hippocrates, aimed at readers with no prior medical knowledge. We'll delve into his groundbreaking ideas, the ethical principles he established, and his lasting impact on the medical field. Stepping back in time, the life of Hippocrates. Much of Hippocrates' life remains shrouded in mystery. Historians believe he lived from around 460 BC to 370 BC on the Greek island of Kos, renowned for its medical school. Unlike his contemporaries who attributed illness to supernatural forces, Hippocrates believed in a rational approach to medicine. He emphasized observation, diagnosis, and treatment based on natural causes. The Hippocratic corpus. While Hippocrates himself likely didn't write all the works attributed to him, a vast collection of medical texts known as the Hippocratic corpus emerged from his school. These texts, translated into Latin centuries later, became the cornerstone of medical education for over 2,000 years. Revolutionizing medicine. Key ideas of Hippocrates. Hippocrates' revolutionary ideas transformed the way people viewed and treated illness. Here are some of his most impactful contributions. The shift from superstition to science. Hippocrates challenged the prevailing belief that diseases were divine punishment or caused by demons. He argued that illnesses had natural causes and could be explained through observation and reason. This shift marked a turning point in medical thinking. Focus on observation and diagnosis. Hippocrates stressed the importance of careful patient observation. He documented symptoms, medical histories, and environmental factors to understand the underlying cause of illness. This emphasis on diagnosis formed the basis for modern medical practice. The power of prognosis. Hippocrates believed in the importance of predicting the course of an illness, prognosis. By carefully observing patients, he aimed to determine if an illness would likely improve, worsen, or remain stable. This allowed him to tailor treatment plans and manage patient expectations. The healing power of nature. Central to Hippocratic medicine was the concept of vis medicatrix natura, or the body's natural healing power. Hippocrates believed that the body, when placed in the right conditions, could heal itself. This philosophy emphasized a more holistic approach to treatment, focusing on promoting the body's natural healing mechanisms rather than solely relying on aggressive interventions. Examples in action. Imagine a patient experiencing a fever, chills, and fatigue. Hippocrates would carefully observe these symptoms, considering environmental factors like recent travel or exposure to others who might be ill. He might then predict that the illness is likely a viral infection and would likely resolve on its own with proper rest and hydration, exemplifying his focus on natural healing. The Hippocratic Oath, a legacy of medical ethics. Beyond his medical contributions, Hippocrates is revered for establishing the ethical foundation of the medical profession. The Hippocratic Oath, a document outlining the ethical obligations of a physician, is still a cornerstone of medical ethics today. Some core principles include patient confidentiality. The oath emphasizes keeping patient information confidential, a principle still central to the doctor-patient relationship today. Do no harm, primum non nocere. This core principle emphasizes prioritizing patient well-being and avoiding actions that could worsen their condition. Modern medical ethics build on this foundation, emphasizing informed consent and avoiding unnecessary interventions. The physician-patient relationship. The oath highlights the importance of trust and respect in the relationship between doctor and patient. This principle encourages doctors to prioritize their patients' best interests and act with compassion. Real-life impact. The Hippocratic Oath continues to guide medical professionals worldwide. It reminds doctors of their responsibility to maintain patient confidentiality, prioritize patient well-being, and act with integrity. Beyond the ancient world, the lasting influence of Hippocrates. Hippocrates' work laid the foundation for the development of Western medicine. His emphasis on observation, diagnosis, and natural healing continues to influence medical practice today. Here are some lasting impacts. The scientific method. The emphasis on observation and reason in the Hippocratic corpus paved the way for the development of the scientific method in medicine. Today, medical research relies on evidence-based practices, rooted in the principles established by Hippocrates. Medical education. The Hippocratic school on Kos served as a model for future medical education. The focus on clinical training and ethical principles continues to be central to medical education programs worldwide. The doctor-patient relationship. The Hippocratic Oath continues to guide the doctor-patient relationship. The emphasis on trust, respect, and patient well-being fosters positive interactions and promotes better outcomes. When patients feel respected, heard, and involved in their care decisions, they are more likely to adhere to treatment plans and experience better health outcomes. The foundation laid by Hippocrates continues to encourage a collaborative approach to healthcare. Limitations and evolution. It's important to acknowledge that Hippocratic medicine had limitations. His understanding of human anatomy and physiology was incomplete, and some of his treatments, like bloodletting, are no longer considered effective. Modern medicine has advanced significantly with the development of vaccines, antibiotics, and other technologies. However, the core principles established by Hippocrates remain relevant. Modern medical practitioners strive to combine the best of both worlds, utilizing scientific advancements while upholding the ethical principles of patient care, observation, and respect for the body's natural healing abilities. A legacy that endures. Hippocrates and the future of medicine. The work of Hippocrates continues to shape the future of medicine. Here's how. Focus on preventative care. The emphasis on understanding the natural causes of illness aligns with the growing focus on preventative medicine. Hippocrates' idea of promoting the body's natural healing abilities aligns with preventative measures like healthy eating, exercise, and vaccinations. Holistic approach. Modern medicine is increasingly recognizing the importance of a holistic approach that considers not just the physical aspects of illness but also the mental and emotional well-being of patients. This aligns with the Hippocratic emphasis on understanding the whole person and creating conditions conducive to healing. The doctor-patient partnership. The emphasis on a trusting and collaborative doctor-patient relationship is more important than ever. As medicine becomes more complex, patients need to be active participants in their healthcare decisions. Conclusion. Hippocrates, the father of medicine, revolutionized the way we view and treat illness. His emphasis on observation, reason, and natural healing laid the foundation for Western medicine. The Hippocratic Oath continues to guide medical ethics, and his legacy lives on in the doctor-patient relationship and the ongoing pursuit of a more holistic approach to healthcare. While advancements in science and technology continue to reshape medicine, the core principles established by Hippocrates remain relevant, ensuring his lasting impact on the pursuit of human health and well-being.